Heavy or light menstrual bleeding. This is, I guess, having light menstrual bleeding. It's usually not much of a problem. Having a heavy bleeding is very, very common. Probably one of the most common, if not the most common problem when in women that are age 40 and older. Of course, when I say that light menstrual bleeding is not usually the thing, the reason for a consult, that doesn't mean it's not a problem. It's simply that it doesn't bother them, so they never go to the medical consultation. But it might be the sign of a problem, so they both have to be checked by a doctor. We call this hyper or hypomenorrhea. Basically, it's actually very difficult to define how much is light bleeding, but let's say then less than 2 days. And of course, longer than 7 days, that's considered a heavy period. Or having to change tampon or a pad every 2 hours or every hour, that's also heavy. That would consider hypermenorrhea. The number one cause for that are fibroids or anything that might change the shape of the uterus. And I guess I'm gonna talk about this because this is actually the most frequent reason why females go for a medical consultation. Hypermenorrhea, heavy bleeding, and in most cases, it's because of fibroids. Some cases, polyps, but mostly fibroids. So I'm gonna stop here a little bit in this picture just to explain. So basically we have here the image of the uterus, which I've shown to explain different things. Here you see the lining, which I already talked about, which is the endometrium. Here they don't pay much attention to that because they wanna focus the attention on this layer, like the dark pink layer, which is muscle. So of course the uterus, it's basically a muscle that has the ability to enlarge and grow to let the fetus, a baby, grow inside, but then it has to have the ability to contract so that baby can get out. So it has a lot of muscle. Sometimes, and actually most of the times, with age, some masses which are in the middle of this muscle start to grow, and they can grow to the outside, it can grow in between the walls of the uterus, or it can grow towards the inside of the uterus. And of course, these are the ones, like the one I'm showing here, that causes most of the problems. Why? Because the lining of the uterus, the endometrium, has to be smooth. So when the menstrual part of the cycle comes, it might actually be like it can shed evenly. But if there is something that changed that shape of the uterus, like a fibroid in here, well, of course, there's blood that's going to get accumulated here, and it's going to be difficult to evacuate. So that period is going to last longer. Of course, the parts under the fibroid are gonna remain normal, but probably here they're going to take a little bit more time to actually evacuate that blood, that tissue, because it's not only blood. How normal is this? And I want you to understand that it's very common. I wouldn't say normal. I would say it's very, very, very common to have fibroids in the uterus, especially after age 35. And as women age, they will start having more and more. They cause several problems, including pain, infertility. But of course, this heavy bleeding, heavy menstrual period, that's number one symptom. Of course, if a if a fibroid is small, it won't cause that much problems, but I want you to understand that I'm talking about large fibroids, which are probably the size of a tennis ball or even larger. So, okay. Here are some other causes: hormonal imbalance and endometrial cancer. Coagulation problems like hemophilia might cause heavy bleeding.